My name is Khalid Yousuf. I'm an orthopedic surgeon at Little Company Emory Hospital. I am fellowship trained in joint replacement surgery, and what I do is focus on hip, knee, and shoulder replacements. I went on after residency to the Mayo Clinic. At the Mayo Clinic, I performed a fellowship for 1 year, specializing in joint replacement surgery. I had the opportunity and blessing to learn from the world's top leaders when it comes to doing innovative hip and knee replacement surgery. I learned anterior approach surgery there. I learned minimally invasive knee surgery and revision surgery. I was also attracted to orthopedics because one of the things I saw in medicine and in medical school was sometimes the most simplest cure is the best cure. And I truly saw patients that were living long lives and healthy lives, had a simple diet, and they were walking still. And I feel very blessed that I, as a joint replacement surgeon, have the ability to help people sometimes improve their ability to walk and continue to walk, and that was another reason I was attracted to orthopedic surgery. A patient who is suffering from an orthopedic issue should consider coming to Little Company Emory Hospital because we provide a university level of care at a community hospital. My partners and I are all fellowship trained in orthopedics, so therefore we're able to take high-level, most cutting-edge techniques and bring it to the community. When a patient comes to see me, I think they will be pleased because they're going to see from the front end a very family feel. As soon as they check in, the gals at the front desk will greet them like they were a family member. They'll have x-rays taken that day so we can evaluate what's going on in their hip or knee disease, and then we'll see them in the room. In the room, they'll meet me. We'll talk about what their concerns are, what kind of treatments they've had to this point. We'll talk about non-operative options and then operative options if necessary. And then at the end of the day, I think hopefully they'll feel that they have a physician that truly cares about their needs. I always joke with my patients that I'll treat them like my grandparents, but they're entitled to treating me like their grandkids. So sometimes that puts me in my place. One of the advantages of having your joint replacement performed at Little Company of Emory Hospital is that we have a comprehensive team for joint replacement. Our anesthesiology colleagues are excellent, and they provide regional anesthesia to provide excellent pain control after surgery. This, along with what we do on the floor with our nurses providing good pain management skills on the floor, have allowed us to discharge our patients as quickly as the next morning after joint replacement. What I find the most satisfying in my practice, when a patient comes back into my clinic walking on their own 2 feet with an early recovery, a speedy recovery, a less painful recovery, is very satisfying.